So my name is Sharon Whiteman, and I am the president and CEO of the Lyme Disease Association of Australia. And I'm very delighted to be having a quick chat with one of our most courageous Lyme patients in Australia. I'd like to introduce you to Natalie Young. Thank you for being here with us today. And I know, Natalie, your journey has been long and tough, and I think it's an important one to talk about. This is all about, thank you. And so, what we want this today is to be all about real patients and their experience of living in Australia with Lyme and associated diseases and tick-borne diseases, and sometimes other vectors that are yet to be established and really deeply researched. So Natalie, let's go back to the beginning. I know that you worked for New South Wales Parks, and it was a career that you absolutely loved, and you had hundreds of tick bites. And then in 2009, one particular bite sort of tipped the whole thing over the edge. Tell us about that.
In 2009, I crawled into a nest of ticks in 2002 and got bitten by 100 ticks. And over the course of time of around 10 years, a decade working for national parks, I had ticks like 30 at a time on me. Often we'd be working in the bush and we'd crawl into nests carrying out bush regeneration on the ground. And I didn't realize I was very young and green when I started with New South Wales National Parks, very young. And I had people tell me, don't worry, it's just scrub itch, don't worry about it. You can't get Lyme, you can't get in, that's not to worry about ticks in Australia. As I was young and green, working for national parks, it's a very male-dominated job, and you have to be pretty tough to work on chainsaws all day, fight fires, and do the range of work that we did. So you don't want to be seen as, soft. So you just sort of push on through, as I did. I had Matilda in 2006. I struggled to become pregnant, so I did IVF. The doctor at that time told me there was something wrong with my mitochondria. He didn't know what. I was lucky to have Matilda through IVF. And in 2006, she was born with a few issues. And I took a year off to look after her and regain my strength because my fatigue kind of got worse and things. But then I bounced back a year after that and I went back to work part-time. 2009, I was working in the bush again and I got another tick on my spine and I had an anaphylactic reaction to that. I was rushed to hospital at Coffs Harbour and I was administered a steroid. At that time, I did not know that I already had infections in me. When I look back, I can look back now at the dates and the times when the sweats and the chills and the body aches for the previous tick bites, something had been injected into me to have that reaction that I didn't know. I didn't have any testing at that time. So 2009, I had the tick on my back and the anaphylaxis, and within 4 days of that hospital visit, I couldn't walk. They thought possibly tick paralysis, but it was more than that. And it just kept going downhill from there. The right side of my neck was really stiff and I started vomiting all the time. I had all this pain radiating down from the base of my brain. My neck was so stiff I couldn't move it. And then I started to lose the use of my arms. I had severe pain off my mid-back region. And I ended up going to a neurologist and he did nerve conduction tests for ALS, which is motor neurone type disease. And he said, you possibly could have motor neurone, because at that time I was starting to lose the ability to hold a cup in my hand. I couldn't even hold a cup. So I was dropping cups and things like that. And I was starting to lose the ability to walk. I was really weak. A massive head pain, headaches, sensitivity to light, ringing in the ears, trouble talking, which again is going in and out, starting again now since I haven't had treatment for 2 years following up from US. So I'm sorry, Sharon, I'm trying to get
That's
my
great.
brain around this with everything going on.
No, that gives us a really good idea. And both of us as Lyme patients, we now can hear this kind of story and realize that's just absolute typical tick bite illness story, and that's replicated all across the country. So, Natalie, tell us a little bit more about your journey to diagnosis and understanding, Lyme and associated diseases, that the label that you got eventually.
It's been an absolute nightmare. It's been torturous. It's been discriminative. It's been cruel. The medical profession in Australia is anti-Lyme. I actually don't like the Lyme word so much by itself anymore. I prefer neurogliosis complex, which my doctor in America likes to call it. And relapsing fever groups as well, as I test positive to relapsing fever, which is Borrelia miyamotoi, which we do not have tests for in Australia at this current time. It's a complex because we have various co-infections. One is babesiosis, which I also tested positive to, which can possibly take you out on its own and is serious and makes the actual neurogliosis Lyme worse and harder to treat. My diagnosis is really hard because by the time I got bitten in 2009, I started to get pneumonia a lot. So I was coming up to a lot of pneumonia, chest infections, things like that. And they're like, oh, she's got pneumonia as well. And, they started to push possibly psych. Then there was doctors pushing MS, trying to push, possibly MS. By the time I got to my head was nodding constantly forwards and backwards. I've got a video of that. One was actually considering Parkinson's disease. There was all these different labels being thrown up at me from neurologists. Till recently, the last year and a half from my decline after I improved in America and started to walk and talk and carry my own shopping in San Francisco. And I've got videos and pictures of all this. 3 months in America was better than 6 months 6 years in Australia of treatment. So
you got diagnosed when did you get an actual diagnosis of
actual diagnosis 2009 by an infectious disease doctor at Royal North Shore Hospital. He patted me on the back and he said, "You'll be okay. You'll be all right. You've got neurogliosis. You've got Lyme disease, not Lyme-like. You've got Lyme." And I struggled to walk out there. I was really stiff and so much pain. I cannot describe the pain. And I thought, I'll be okay. He's told me I'll be okay. He referred me to an immunologist in Newcastle, who at that time, he said, "I don't have experience treating this. I have no idea what to do." This is what he said to me. So he called Germany and he said, "Look, what do we do?" He said, "Well, send the blood over and I'll retest it," because it had been sent to America and it was positive in America. The German doctor, which was Armin Schwarzbach, by the way, and he was on the Senate advisory committee, he tested my blood and he said, came back positive to Borrelia burgdorferi at that stage only, and then later on relapsing fever. It came back positive and he said she's got late stage neurogliosis. She requires extensive IV therapy and possible other treatments. At that time, I didn't realize until I went to America that I had severe autoimmunity starting as well. And no one until 2018-19, when I went to America, had actually considered the autoimmunity, which is a huge part of the disease process. And I was lucky to see Dr. Alina Fried in New York, who's an expert in tick-borne disease, autoimmunity of the brain. And she said, "You've got like this neuroinflammatory autoimmune condition triggered by the tick-borne disease." She sent my blood all around America, New York, not just to IGNX, she sent it to Northwell Laboratories, which is actually a army, the US military use this lab to treat, if something comes back positive, they treat their patients in the army, in the US military. So I came back to borreliosis again, quite strongly on a lot of Borrelia-specific bands. Also came back still to babesiosis, which was resistant to treatment on a 1,256 titer. And I came back to chronic disease of chlamydia, pneumonia, and mycoplasma. If you look at the doctors who understand these diseases, I mean, I've sat in front of some of the best doctors in America with this, and they really understand it. And I can tell you now, the difference between sitting in front of a doctor in America to here is huge. We have no experts on this in Australia. I can tell you now, all I've done is decline in this country. I mean, I've got GPs that are holding me, probably saving my life to a degree, but it's not enough. I don't think it's going to save my life. I'm back to the point that I can't walk properly. I'm losing the ability to talk and losing my brain at times again. I'm becoming mute. I'm having trouble breathing again at times. I'm in so much pain. Like, I'm screaming, I'm in so much pain. And that's not me. Like, that was pre-US, and they had all that under control. So all I can say is we have no experts on this. And if they profess to be an expert, I'd like to ask them how many patients they've actually treated, because my doctor in America has treated over 15,000 chronic Lyme, tick-borne disease associated, not just Lyme, but the other diseases. My experience in the hospital system here is, this is what's happened
But
to
let's
me.
just back up a little bit, Natalie. So you got diagnosed and you had treatment up until you decided that, listen, I'm not progressing, I'm slowly declining, even with the best treatment in Australia. And what did you have to do to fund your trip overseas?
I had to sell my house. I had a beautiful beach house at Corindy Beach in North New South Wales. And my GP at the time in Queensland, he said to me, if you don't sell your house, you're going to die. So he said, you need to sell your house to survive. So, and so did my other doctor at Bellingen. So I sold my house.
And so then you've already described.
Sorry,
Go ahead.
yeah.
Well, you've described beautifully, the multidisciplinary approach that you experience in the US. So while you're in the US, you're there for how long? And you had treatments in Mexico and in 2 parts of the US?
Yeah, I required plasmapheresis. It's really expensive in America. And red blood cell exchanges for the babesiosis because it was resistant, and they did smears, which they did for 3 to 4 days, and serology as well. Here they've only did 1 day of several smears, and that was it, which apparently isn't enough. So I required several blood transfusions with the red blood cell exchange. So I went to Dr. Omar Morales in Mexico for that. Otherwise it was going to cost like $80,000 just for with no insurance in America. So that was the reason I went for certain treatments there and then went back to the US as well. Dr. Stephen Harris found that I had autoimmune encephalitis, GAD65. He kind of said to me, what are they doing to you in Australia? Like, how have they not detected that you couldn't walk, couldn't talk, having seizures all the time? Why wasn't this like even considered in the diagnosis with infectious triggering it? So he was kind of regurgitating to a degree what Alina Freed was saying to me, the neurologist in New York. They kind of think along the same lines. And I guess Natalie, that's how they get their patients better, because they understand it and they listen to the patient. I've noticed here, all they seem to do here is be so dismissive, and they want to blame this thing called cognitive behavior therapy. Like, they tried to push that on me in 2019 before the US. Like, that was mentioned to me as well. Like, I just can't believe how ridiculous it is. You're in this much pain. You've got a history of tick-borne disease. You've got, I put in front of them, and my doctors have been, they've asked to collaborate with the doctors here in the so-called best hospitals in Australia. They've been willing to talk to these doctors to get me better. And they won't talk to them. They won't even pick up the phone. They won't acknowledge any of the testing from Germany or America. We don't have the tests here for half of the infections I've had or got.
Yeah, testing is problematic.
The autoimmunity as well. They won't recognize. I've had test results they've refused to do. The last hospital visit, they wouldn't do the antineuronal test, and they made some excuse that my blood got frozen. There's always an excuse for something.
So Natalie, just backing up again. So you went to the US, and what happened to cause you to have to return prior to the full treatment protocol being completed?
Well, I ran out of money. By the time I'd paid off my debts of my house and then the bit left over, I had to go to America. I didn't have enough to stay. So Dr. Harris said to me, you're a 0, I'll get you to a 4. But to get you to a 7, I need you to stay longer. I required more plasmapheresis for the autoantibodies. And the high infection, inflammatory load. Dr. Harris explained that really well. Like, with the amount of endotoxins and different cytokines and things in my blood, and how much inflammation I have, and the autoimmunity, and how you've got to do a dance with the body to mediate the immune system while you're fighting these infections. That doesn't happen here. If you're
So
lucky, you'll
Natalie,
get basic antibiotics.
yeah, so you returned in November of November 2019, was it?
2019, yes.
Yeah. And so since then, you and I have been working really hard to replicate that same treatment that made such a difference in the US for you. So how many hospitals do you think admissions that you've had in those 2 years?
Hospitals, probably in the Hunter, I had 12 admissions to one hospital. That's just one hospital. In Sydney, I've had several. I was put into several Sydney major hospitals and a private hospital, and I had severe hemolysis and oxidizing cells, and they kept throwing me out saying it was just psych. And then I ended up with 2 lungs full of blood clots and infective endocarditis because my line hadn't been managed, and they didn't think that it was actually infectious. So I think over probably 12 admissions to the Hunter, they actually rang me up, and probably another 8 maybe.
Yeah. So, and we're not here to, incriminate any individual Australian practitioner. So, but our knowledge over the last 2 years of working really hard and fighting for your life here in Australia has been that, number one, they haven't seemed to be willing. Well, nobody yet has been willing to liaise with your American doctors in regards to the treatment that actually did help you recover. Is that correct?
No one has, no.
Yeah.
And I go to, like, I wait 3 months for a doctor's appointment, and then they say, oh, this is not my scope. This is either too complex or this is not my scope. Some don't even charge me for the appointment.
And sometimes, we've had the good fortune to be able to get a multidisciplinary referral, like you're needing neurology and immunology and infectious disease and sometimes hematology. And when we get all those conditions set at a different hospital, because we keep having to try different hospitals, they get like I'm a former ICU nurse, and when watching from the outside, what I see is them trying to pigeonhole you into one of those categories, as opposed to these specialists working together in a multidisciplinary way, because Lyme, advanced and chronic and untreated Lyme and associated diseases crosses multiple systems, and they all need to be addressed in quite a synchronous way. Would you say that's true, Natalie? Is that your experience?
Yeah, they do, because I mean it's affected every part of my body.
Yeah.
It's a neurological disease, neurogliosis. But as soon as they hear the Lyme word, they don't help.
Yeah.
They don't work together. They make what I see is they make out they're working. We brought this team in, blah blah. But what it always ends up is psych pushing the argument for neurology, for neurocognitive behavior, while they ignore the pathology.
So, from looking from the outside, it seems like, the knowledge in Australia, because it's tick-borne disease has been so controversial for whatever reason, we can just make it up. That's not the point today. That medical knowledge doesn't extend beyond health policy, and that they're so at risk for their livelihood and their own personal reputations that they're stuck in even being able to assist you in the way that's possibly world's best practice. So, the US, Lyme has challenges everywhere, doesn't it? But in the US, they've continued to advance their knowledge over the last 25, 30 years. And sadly, that's been hampered here in Australia. So,
well, they won't help us. What they say to me, and this is what I've had doctors say to me, the 2 last doctors that have said I've had this, they've said to me, you've got neurogliosis. They say to me, I'm not going to lose my license, like you, but I'm not going to lose my license treating you. I don't like you that much that I'll lose my license treating you. This is what these doctors say to me. Doesn't make me feel real good that my life doesn't matter enough to save because they're not allowed to treat my disease, which is allowed to be treated in other countries. So the international coding that doctors put in for my diagnosis in America, if I was a national park worker in America, I'd be covered by insurance and I'd be treated to the point that I can rehabilitate and be with my daughter and live a good life. But here they want to keep you disabled. Well, I don't know if they want to, but they're keeping us disabled
Their
by
inaction does, yeah.
this policy and this name DISCAT, debilitating symptoms attributed to ticks. All that has done is isolated us from the rest of the world. 20 years of research in America and in Germany, the best doctors with huge high patient loadings, doctors that have got patient loads of 15,000 people. This is a complex disease. They should be talking to these doctors overseas. I've spoken to doctors here. I said, how many people have you treated with this? Oh, possibly one or two. I said, were they chronic or acute? Acute from America. There's no one dealing with chronic, any tick-borne disease. We have nowhere to go. We have nowhere to go. And of course, we're going to present with psych symptoms. We're inflamed. Our brains are inflamed. Of course, we're going to have psych symptoms. It's part of the disease. It shouldn't be held against us.
Well, it's
It's
secondary
not
to
just
infection.
psych. If they look closer, I can't even hold my head up to the point some days. Like I can't walk properly. And they're saying I'm making this up. I am not a lazy person.
You're an athlete. You're a former athlete.
I
Natalie,
was, and
yeah.
I want to get better. And I was getting better in the US, and I'm not here. And I deteriorate when I come back to Australia. And it's heartbreaking and it's demoralizing. And I don't know what to do anymore because I'm fearing for my life again. I've been back 2 years and I'm frightened. I have nowhere to go.
So
I
Natalie,
don't know what to do.
you know, I know what you want more than anything is to stay alive and to be a mom to your daughter, gorgeous, beautiful daughter, Tilly. And I know in the last 2 years of helping you almost 24/7,
Mhm.
every step you take also in your heart is every other Lyme patient in Australia. I've never known someone to be so driven to also, and who's so demoralized by the suffering of the others you see around you. What do you think? Obviously from what we've said today, so far today, is our doctor needs support in Australia, support and training and access to
Our
international.
GPs need support. The GPs that are saving lives today with this because the specialists have let us down. The infectious disease doctors let us down. The immunologists, the hematologists, the neurologists especially. Like this is a neurological disease. I don't see how none of them are seeing what's happening. Like they're just totally ignoring this.
Yeah.
Um,
And so, Natalie, what would your call to action be to government, to interested people with influence?
We need a clinic in each state, or we need one in the whole of Australia for tick-borne disease. We need to collaborate with doctors overseas. We need to open up to the testing done overseas, to these labs that have been testing this for years for variant strains of Bartonella, babesiosis, relapsing fever strains, Lyme, not just Lyme. Lyme's just one part of it, but neurogliosis complex. And neurogliosis is an immune suppressive disease. They don't even understand this here. And it's, you have autoimmunity, but it's not an autoimmune disease as such. And there's doctors giving patients steroids for this, and that's contradicted in this. So we need to collaborate with doctors who understand the severity of this disease because patients are being harmed here by not collaborating. We don't have the expertise here. We can't wait for research anymore. Like some of us are not going to make it if we don't get treatment in the next year or so. We're going to be more damaged. Like some won't make it. Like I've lost friends to this. I've already lost a friend through national parks. He got misdiagnosed with motor neurone and he had this. His test came back 2 weeks before he died. He had this. So it's not coincidence that these national park workers are sick. My whole work depot, well, there's at least 3 diagnosed in the Coffs Harbour region with this on work cover, have been on work cover. There's other people at Pacific Bay Resort. There's people up here that are sick in Coffs Harbour.
Yeah.
This is huge. This is big. It's up the whole East Coast, and we need to collaborate. And we need a clinic, and we need it now. The hospital system cannot look after us. It doesn't. It's proven not to look after us, and we're being damaged. We have nowhere to go. So that's all I can say is we need funding, and we need clinic, and we need a treatment center now. And we
Yeah,
need
and
access to
recognition.
treatments like plasmapheresis, IVIG. You know, we need immune
Yeah,
therapies, because
yeah,
you cannot just treat late stage with antibiotics. It doesn't
yeah,
work.
that's right. And so we need our doctors supported. What's in your heart to talk to other patients who are doing it tough in Australia?
I don't even know what to say anymore, because I want to say there's hope, but at the moment there's not. And that's really hard, because I don't want to pretend. I think they have to rise up. I think they have to stand up. I think more people have to speak up the truth. And what I want to say is, don't be afraid. We've been shamed. We've been ridiculed. You know, I'll speak the truth until I die now, because I said to myself when I couldn't talk before I went to America, I've been shamed so much. I mean, I've been called a druggo because I'm so thin and I can't talk or walk. You know, I've had ambulance people like say stand up when I can't stand. I physically cannot stand up. You know, they're yelling at me, come on, you can do better than that, have a go. And I'm like, how can someone say this? They just don't get that I cannot stand up. I cannot physically stand up.
Yeah.
I
But
say
you're right,
speak the
Natalie.
truth.
You know when we're the true loss of hope is when we quit trying, isn't it? So, you know, on behalf of the Lyme Disease Association and our team that works tirelessly to support patients in Australia, on behalf of every patient in Australia, I know it took us several goes for you to even be well enough to be sitting up to do this week, Natalie, and just know that you're in our hearts, and so is everybody in Australia who's suffering with Lyme and associated diseases. Thank you for
Thank
your
you,
time
Sharon.
today.
I mean, there's so many of us, and I just think people need to speak the truth. I think people have been belittled so much by the system at the moment that no one's willing to stand up. And it's really sad, because we're suffering because of it and no one's listening to us.
Yeah. And the discat pathway has definitely sealed our fate. So there's
This
nothing
cat
to do but to stand
pathway,
up.
I mean, you've only got to
Cri-
look at what doctors are saying from across the world.
Yeah. It's a criminal failure, and it's harming Australians, and it's stopping doctors from being able to operate under their ethical code and moral code. So ladies and gentlemen, stand up with Natalie and stand up with us. And we're here for those Lyme patients listening or watching this now. We're not giving up. Thank you for your time today, Natalie.
Thank you, Sharon. Bye.